You know, what a special day this is. I made a speech earlier this year, the state of the state, and I said one of our top priorities in the state of Illinois this year was to get this law passed. And I'm very, very grateful to the members of the General Assembly who voted yes for expanding Medicaid. This is essentially implementing the Affordable Care Act. Some call it Obamacare. I call it I Do Care. And this is the way that we, the people of Illinois, are going to get more health insurance coverage for at least 342,000 of our neighbors. I think that's really an important objective that all of us have, decent health care for everybody. And our president made that very clear right after he was sworn in back in 2009. He said it's important that we in this country work together to extend health coverage to people who don't have it. That's an important fundamental right that everyone has. It's not a privilege to have decent health care. It's a fundamental right. And 12 years ago, about this time, I was on the Mississippi River at a bridge called the Centennial Bridge in Rock Island, right above the river, Big River, and I was with my doctor, Quentin Young. And we walked across Illinois from the Mississippi River all the way to Lake Michigan in Chicago. We walked right by this very building on behalf of decent health care for everyone. And I've always believed that. You know, it's important not only to have a belief and concern and a vision, but you have to actually accomplish it. You have to have a record of getting it done. And I want to commend all the people who worked on this historic mission, not only members of the General Assembly, but all the organizations, all the individuals who banded together, who understand that we in America, we can do better when it comes to health care coverage for people who need it. And today in Illinois, the home state of President Obama, who will be here in our state this week, on Wednesday, he's going to Galesburg. And I was very, very concerned that we get this bill signed into law today before the president gets here so we can tell him we got the job done. I think it's also important to realize that the signing of this bill creates jobs in Illinois. I had a lady come when I was walking in. She said, we need more jobs in Illinois. I totally agree with her. I work on that every single day. All of us have to work on that. And we know that health care is a very, very important sector of our economy. And we're going to be getting $12 billion in the next few years from the federal government to our state to implement this important health care reform. And that is going to put people to work. We want folks not only to get health insurance coverage, but we also want the other principles of the Affordable Care Act. You can't deny people because of pre-existing conditions. You got to make sure that people get a fair shake when it comes to their health insurance. And so I want to make sure that the folks who made this day possible in the legislature, when I spoke before the legislature in the State of the State address, I said that we have to team up together. Members of the legislature I talked to and my members of my staff talked to about how important this is to our economy in Illinois, to our health care safety net. We want to make sure that no one falls through. We want to have a wellness society in Illinois. We don't just want to treat people when they're sick. The passage of this law that I'm going to sign today also makes sure that we have preventive medicine. And we're going to work with great hospitals like we have here in this very institution, as well as around here. There's 3 other major hospitals, Stroger Public Hospital, as well as Rush, and also Jesse Brown Veterans Hospital.
Couple points. As you mentioned, there are 342,000 more Illinoisans who are going to get health care coverage because of this bill. Now, 60% of these folks have jobs. It's all single adults, these newly eligibles. 60% of them have jobs, but at low-income jobs that don't provide affordable health care. And the other important key is to know is that every part of the state, people get views about who this is at getting coverage. We had done the analysis, and it's every single part of the state where we have people who are going to be newly eligible here. It's critical for downstaters, for our suburbanites, for the city of Chicago. It's everywhere. And there's 3 sort of really key benefits to getting this bill enacted here. First, and most importantly, it's better health care for folks. We're going to be keeping people healthier. As the NIH says, 14%, estimated 14% of health care right now is provided in emergency rooms. And that's largely this population of single adults who are showing up in emergency rooms because they don't have access to health care. These folks are now going to be getting access to preventative coordinated care programs, thanks to the leadership of Julie Hamas and her department, which we're going to hear about, providing much more coordinated care for these newly eligible folks to get them things like mammograms and colonoscopies, get them their blood health, their blood control medications, or if they have diabetes, get them asthma control. All these kinds of things to keep them out of emergency rooms and keep them healthier. That leads to the second big cost, and that's, second big benefit here, and that's really economics. We are going to get $4 billion over the next 3 years, $12 billion from the feds over the next 20 years, through 2020, it's estimated. $12 billion into the state, no cost to the state for the first 3 years of implementing this program. After the first 3 years, the federal government, it tapers down to about 90% of coverage that they provide for this group. It replaces what the state's paying for right now, what local governments are paying for right now, and really all the uncompensated care that hospitals are having to do. So this is going to help every single hospital throughout the state of Illinois. And it also helps small employers who will no longer have to pay penalties because if folks that could be on Medicaid can now have access to that. They'd be subject to penalties if this was not the case. Another reason why the Illinois Chamber of Commerce was such a strong supporter of this bill and worked so hard to help get it passed. And then the third key benefit really is that we're going to create an enormous number of jobs. I've seen some reports that estimate up to 19,800 jobs throughout the state are going to come because of us implementing this bill. So that's really the contours of it, why it's so critical. One thing that might get overlooked that this bill is also doing is really providing new models of care for a very underserved population in Illinois, and that's folks with mental illnesses. We're creating a new continuum through specialized mental health rehab facilities where right now people with mental illnesses in Illinois end up in hospitals, emergency rooms, they end up on the street, they end up in the jails. We're now going to be stretching and improving the quality of care that we're providing to these folks with mental illnesses, which I think is another very valuable part of this bill. Look forward to working on the implementation. It's now a lot of work. There's a lot of hands on deck to get this bill passed. I want to thank everybody here because you all had a role in that, and thanks particularly again to the Governor Quinn for his leadership.
I think one of the things, I've been in the legislature for a long time, and prior to that I worked for the Senate President when he was a mere House and then mere Senate member. And the people who used to live and walk into our office and that lived in our community we had the largest single head of household community. We had the largest onesie community, if you will. Many of them were students, a lot of entrepreneurs and small business owners. And our district was disproportionately affected by people who were those very childless adults who did not have access to health care. So from the perspective of a legislator trying to meet a need, trying to find a medical home for our constituents, this legislation today is the game changer. I think we should all take a moment and thank the big guy in Washington for that. It was always a pleasure to work with President Obama when he was in the legislature, and for him to, today with a single stroke of the pen, Governor Quinn will bring 342,000 Illinoisans who have been scrambling along with HFS, DHS, the Department on Aging, for this community to try and figure out how to get their needs met. And we also pay enormously for this in other parts of our budget and in other parts of society, as Senator Steens met. I remember hearing a story about a woman who felt a lump in her breast, and she had no place to go, and someone in her community told her to walk into a small business and shoplift, and that if she wanted health care, the best place for her to get it was county jail. And I think that today we change all that. Today we sign a document that reflects the principles and the direction that the state of Illinois is going in. And I want to also thank all of the advocates, the very, very diverse, non-traditional allies that work together for this common good. It was an honor to shepherd this through the House. It was challenging. One would wonder why we wouldn't want $12 billion of health care that is 100% match. For the first time, we are getting federal match for people living with mental illness in the state of Illinois. So we are not just walking the walk or talking the talk. We are really putting our money where our mouth is, and we are going to finally find medical homes. And also, the leadership of HFS and the fabulous Julie Hamos and her staff cannot be underscored. It was an honor serving with Julie when she was a House member, and I believe that she has really steered this ship. Governor Quinn, this is the cornerstone of your administration. I think that one of the things that we are all so proud of and why we love having you as governor is because you're very real and you understand the gravity of this.
I'm a little bashful about being singled out by Representative Feigenholz because this is totally not about one department, one person. This is about all of you and really our sister agencies who are here today and the directors in Department of Public Health, in the Secretary of Department of Human Services, the Director of the Department of Aging. We are such a team, and this is a team effort. But what I really want to do at this most exciting, historic moment, when we are finally going to fulfill the American dream, which is universal health care coverage, coverage for all, health care for all. And we are on the verge of doing that here in Illinois, but not there yet. So I want to thank all of the partners that came together to pass this bill. With a very strong General Assembly and some of the members you've met today, we want to thank them. Certainly the very strong coalition that was built around this, spearheaded for our administration by Selma D'Souza, our legislative director, so this is a very important day, but this is just the beginning. And what we really need your help with is this is not just about putting the Affordable Care Act, and the promise of the Affordable Care Act is not just about putting a health insurance card in everybody's pocket. It's about redesigning the healthcare delivery system, and we are very hard at work doing that to create coordinated, integrated delivery systems that will really serve the clients, the uninsured, and really the insured as well, because there's a big effort going on now to do this across payers, across providers. We are part of that in Medicaid. But what we really also need then is to make sure that all of you, the coalition partners, are still engaged in taking people by the hand and getting them not just to sign up, but to get them to a doctor or a clinic, to get them into primary care, and to pay attention to their own health needs. The promise of the Affordable Care Act is to get better health outcomes for all the people in Illinois and the country. That's the most exciting part. That's the work still ahead of us. And we want to once again thank you for the really great work that all of you did to get us this far. Thank you.
Thank you, Julie.
But at the end of the day, it really is about access. And from a public health perspective, we know that access is not the whole enchilada. It is important. It's a very important part. It's not the whole part. But for 340-some thousand folks, it's going to really make a real difference. So access to continuous quality health services, from wellness to prevention, from acute care to chronic disease management and oral health, all the way to end-of-life care and hospice care, is going to make a real difference. And significantly, this legislation is targeting those who are most vulnerable among us. So children, including foster children, those with mental health needs, those with disabilities, those with chronic medical conditions, those in long-term care facilities, others, single childless adults who need help in bolstering their wellness and help in navigating the healthcare landscape when they get in trouble and when they really need some health care services. At the end of the day, when history looks back on this day, as I'm sure it will, and when it looks back on the story of health reform in Illinois, I think that we can all collectively swell with pride, knowing that we each were a part of this historic transformation and that we championed this groundbreaking legislation and many other things to come that really changed the lives for those and made a real difference in the lives of those who are most vulnerable. Thank you.